I need you to stop whatever you are doing right now, because what I am about to tell you could save your life or the life of someone you love before this week is over. There is a virus moving through communities across the United States right now. It is not making the evening news the way it should. Most doctors are not bringing it up during routine appointments, and it is quietly sending people, particularly adults over 60, into intensive care units with almost no warning at all. Nearly half of the people who develop the most severe form of this illness do not survive it. And the reason adults over 60 are in the most danger has everything to do with changes happening inside your immune system right now, changes that most people have never been told about. I am going to tell you everything today: what this virus is, how it gets inside your body, what it does once it is there, and most critically, the 5 specific things every adult over 60 must do this week to protect themselves and the people they love. Please do not skip ahead. What I share at the end of this video, the single most important step on the list, is something almost no one over 60 is actually doing, and the reason why is going to shock you. Before I go any further, I want to hear from you right now. Leave a comment below telling me your age and whether you have spent any time recently near a cabin, a storage shed, a garage, a barn, a garden space, or anywhere that rodents or mice might have been present. You might be more at risk than you realize, and when you think about it carefully, that answer might surprise you. I read every single comment on this channel, and what you share directly shapes what I cover next. My name is Dr. Clara Smith. I have spent over 20 years practicing medicine and studying how infectious and environmental diseases affect the aging body in ways that are fundamentally different from how they affect younger people. What I am sharing with you today is not meant to frighten you. It is meant to equip you. Because in medicine, the most powerful thing I can give any patient is not a prescription. It is knowledge they can actually use. So let me start at the very beginning. Because before you can protect yourself from something, you need to truly understand what it is. I want you to imagine your body as a city, a well-organized, functioning city with millions of citizens working around the clock to keep everything running. Your immune system is the police force, the security network, the emergency response team, all rolled into one. Now, imagine a criminal so small it is invisible to the naked eye, so clever that it does not come through the front gate. It slips in through a ventilation shaft. It bypasses every checkpoint, and it goes straight for the city's power station, your lungs, and your heart. That is exactly what this virus does, and that criminal has a name. It is called the Hantavirus. Hantavirus is a single-stranded RNA virus, which in plain English means it carries its genetic instructions in a ribbon of material so efficient and so precise that once it enters your cells, it hijacks them and forces them to manufacture copies of itself by the thousands. It belongs to a viral family that has existed on this planet for thousands of years, living quietly and harmlessly inside rodent populations. The deer mouse is its primary carrier in North America. And here is the thing that makes this so unsettling. The deer mouse does not get sick. It carries the virus in its saliva, its urine, and its droppings, and it sheds it into the environment constantly, silently, with no outward sign that anything is wrong at all. There are several strains of this virus found around the world, and each one targets a different part of the human body. In North America, the primary strain responsible for the most severe illness is called the sin nombre virus, which means, with grim irony, the virus with no name. It was first identified in 1993 during an outbreak in the Four Corners region of the American Southwest, where a cluster of young, previously healthy people died of a mysterious respiratory illness that left physicians completely baffled. In South America, a related strain called the Andes virus has caused outbreaks in Argentina, Chile, and Brazil, and it carries a distinction that has researchers watching it with great concern. It is the only known strain of hantavirus with documented cases of human-to-human transmission. In parts of Asia and Europe, other strains cause a condition that attacks the kidneys rather than the lungs. But all of these strains share one critical thing in common. They exploit precisely the kind of immune vulnerabilities that accumulate naturally inside the aging body. And that is why today's conversation is specifically for adults over 60. Now I need to explain how this virus actually gets inside you, because this is where most people are dangerously uninformed, and where the risk is often hiding in the most ordinary places. The primary route of infection is not a bite. It is not even direct contact. It is your breath. When an infected rodent urinates, defecates, or leaves its saliva in an enclosed space, the virus particles attach to tiny dust particles and become airborne. Scientists call this aerosolization, and it happens invisibly and silently in spaces that most of us walk into without a second thought. A garage that has been closed all winter, an attic you have not entered since last fall, a garden shed, a basement, a storage barn, the interior of an old camper, or a vehicle that has been sitting unused. When you walk into one of those spaces and you breathe the air, those invisible particles travel down your airway and into your lungs, and the infection begins. Research published in the journal Emerging Infectious Diseases confirm that hantavirus particles can remain viable and infectious in the environment for several days, and in cool, dry, sheltered conditions, potentially even longer than that. Secondary routes of infection include touching contaminated droppings or nesting materials, and then touching your eyes, nose, or mouth. Rodent bites are a less common but documented route as well. Here is something I need every adult over 60 to hear and to hold on to. After the age of 65, a system in your airways called mucociliary clearance, which is made up of tiny hair-like structures that line your respiratory tract and sweep foreign particles out before they can reach your deep lung tissue, loses approximately 30 to 40% of its efficiency. Research from Johns Hopkins University School of Medicine documented this decline precisely. What this means in practical terms is that the very first line of defense your body has against an inhaled pathogen like hantavirus is significantly weaker than it was 30 years ago. What a healthy 35-year-old might partially clear before the virus reaches the deepest parts of the lung, a 68-year-old is far more likely to inhale all the way down to the alveoli. Those are the tiny, delicate air sacs deep inside your lungs where oxygen enters your blood. And those are exactly the structures this virus destroys. Let me walk you through what actually happens inside the body after exposure, because understanding the timeline of this disease is not just medically interesting. It could be the thing that saves your life or someone else's. After exposure, the virus enters what is called an incubation period, the silent window between first contact and the appearance of symptoms. For hantavirus, this window ranges from 1 to 8 weeks, with most people developing symptoms between 2 and 4 weeks after exposure. Think about what that means. You could clean out a dusty garage on a Saturday in April, feel perfectly normal for 3 weeks, and have absolutely no idea that a biological storm is building inside you. This long, silent period is one of the most dangerous features of this disease, because by the time symptoms appear, the virus has already been replicating inside the cells lining your blood vessels for weeks. The illness begins in what physicians call the prodromal phase, and I want you to picture this phase as the sky darkening before a hurricane. The clouds come in slowly, the air changes, but nothing has broken yet. For the first 3 to 5 days, the infected person feels what most people would describe as a bad flu. Fever, fatigue, muscle aches, particularly in the large muscles of the thighs, hips, and back. Headache, dizziness, sometimes chills, sometimes nausea. In a busy clinic or emergency room, these symptoms look like influenza, like COVID-19, like any number of ordinary viral illnesses. Most physicians, unless they are specifically looking for it, would not suspect hantavirus at this stage, and most patients would not think to mention that they spent a weekend cleaning out their storage shed 3 weeks ago. But while that patient is lying at home thinking they have a bad cold, something critical is happening inside their blood vessels. The virus is multiplying inside the cells that line those vessels, called endothelial cells. And as it multiplies, it causes those cells to leak. And that is when everything changes. Within 4 to 10 days of those first symptoms, the disease enters what is called the cardiopulmonary phase. And this is the phase that sends people to the emergency room in an ambulance. As the blood vessels in the lungs become increasingly leaky, fluid begins flooding the alveoli, those delicate air sacs that should be light and open and full of air. The lungs, which in a healthy body feel like soft sponges, begin to fill with fluid. The patient develops rapidly worsening shortness of breath, not a mild breathlessness, a terrifying, gasping inability to pull in enough air. Oxygen levels in the blood drop, blood pressure falls. The heart, struggling to pump without enough oxygen reaching it, begins to fail. Hantavirus Pulmonary Syndrome can progress from the first sign of breathing difficulty to complete respiratory failure in as little as 24 to 48 hours. Many patients go from feeling like they have a bad flu to requiring a mechanical ventilator in under 2 days. There is no approved antiviral medication to treat this infection once it has taken hold. Treatment is entirely supportive. Oxygen, mechanical ventilation, careful fluid management. The medical team essentially keeps the patient alive and breathing while their body tries to fight the virus on its own. This is not a disease where a doctor can write you a prescription and send you home to recover. Prevention is not just the best strategy. In many cases, it is the only one. Patients who survive the cardiopulmonary phase, and with intensive care in a modern hospital, many do, eventually enter a recovery phase, where the excess fluid begins to be cleared by the kidneys. But recovery can take weeks to months, and some survivors report reduced lung capacity and persistent fatigue for years after the acute illness has resolved. I want to tell you about real people this has happened to, because I think it is important that you understand this is not a theoretical threat. In the summer of 2012, a cluster of visitors to Yosemite National Park in California developed Hantavirus Pulmonary Syndrome after staying in tent cabins in the Curry Village area of the park. 10 people were confirmed infected. 3 of them died. The CDC investigation found evidence of rodent activity inside the insulation of the cabin walls. Thousands of people who had stayed in those structures had to be notified and monitored. The outbreak made national headlines and forced the complete redesign of those facilities. In 2020, a man in his early 60s in Washington state, a retired farmer in generally good health, spent a weekend cleaning out a long unused storage barn on his rural property. He wore no respiratory protection because he had done similar cleanups many times before without any problems. Within 2 weeks, he developed what he thought was a severe cold that turned into pneumonia. He was hospitalized and on a ventilator within 48 hours of being admitted. He survived after 18 days in the intensive care unit, but spent the following 8 months in pulmonary rehabilitation and reported that his breathing never fully returned to what it had been before that weekend. In the Chubut province of Argentina in 2019, an outbreak of the Andes virus strain resulted in 29 confirmed cases and 11 deaths. Health authorities documented chains of transmission moving through households, and in one documented case to a healthcare worker who had treated an infected patient. The World Health Organization issued guidance in response. In Colorado, Utah, and New Mexico, public health departments report sporadic cases of Hantavirus pulmonary syndrome every year, particularly in the spring and summer, when rodent populations peak and people begin spending time in outdoor structures that have been closed through the winter. In 2023 alone, Colorado confirmed 3 cases, 2 of those involved adults over 65. 1 of them did not survive. These are not statistics. These are people who cleaned a garage, opened a cabin, or worked in a shed. People living exactly the kind of active, independent lives that you deserve to live. And what separates the ones who were protected from the ones who were not is simple: information and preparation. So let me walk you through the 5 things every adult over 60 must do this week, starting at number 5 and building toward the single most powerful step you can take. I promise you, by the time we get to number 1, you will understand exactly why I saved it for last. The first thing you need to do, and I want you to do this before the end of this week, is conduct a thorough rodent audit of every enclosed space on your property. Your garage, your basement, your attic, your garden shed, any outbuildings, your crawl space, any vehicle that has been sitting unused for an extended period. You are looking for the signs that rodents have been present. Their droppings look like small, dark grains of rice. You may see gnaw marks on wood, plastic, or food packaging. You may find nesting materials made from shredded paper or fabric or insulation pulled from walls. You may notice grease marks along the base of walls where rodents travel the same paths repeatedly, leaving traces of their fur and body oil. And you may notice a musty, distinctive odor in an enclosed space that you did not notice before. Do not do this inspection carelessly. Before you enter any enclosed space, open the doors and windows and allow fresh air to circulate for at least 30 minutes first. This allows the concentration of any aerosolized particles in the air to drop significantly before you breathe that air. Do not bend down close to the ground and sniff. Stand back, look, and if you find evidence of rodents, do not touch anything yet. Do not sweep, do not vacuum. I will explain exactly what to do instead when we get to step 3. Why does this audit matter so much for your body specifically? Research from the University of New Mexico found that approximately 12% of deer mice trapped in rural areas of the American Southwest carry sin nombre virus. Roughly 1 in 8 mice in those regions is a carrier. And after the age of 70, your innate immune response, the rapid first responder system that attacks pathogens in the first hours of exposure, before your slower adaptive immune system has even been activated, is operating at roughly 40% of the efficiency it had when you were 40 years old. You do not have the same biological margin for error that a younger person has. A contaminated space that a 30-year-old might walk through and clear with minimal consequence could be far more dangerous for you. The audit tells you where the risk is before you stumble into it unprepared. One practical note: do this audit with another person if at all possible, not just for the help, but so that someone knows where you are and can respond quickly if you feel any respiratory distress in an enclosed space. The second thing you need to do is understand proper protective equipment. And I want to be very specific here because the details matter enormously, and the most common mistake people make is thinking that any mask will do. It will not. If you are going to enter any space with evidence of rodent activity, you must wear a certified N95 respirator, not a surgical mask, not a cloth face covering. An N95 respirator that fits tightly against your face, creates a seal around your nose and mouth, and filters out at least 95% of airborne particles. A standard surgical mask allows air to flow freely around its edges. It provides essentially no protection against the microscopic particles that carry hantavirus. Every breath you take in a contaminated space while wearing just a surgical mask is potentially an unprotected breath. You also need disposable nitrile gloves to prevent direct skin contact with droppings or nesting materials. If the evidence of rodents is significant, disposable Tyvek coveralls or old clothing that you can immediately remove and bag for washing in hot water is advisable. I understand this might sound excessive for a trip to your own garage, but consider this. A set of N95 masks and a box of nitrile gloves costs roughly $15 to $20 at any hardware store. The average intensive care unit stay costs between $3,000 and $10,000 per day, and no amount of money buys back the lung function lost to Hantavirus Pulmonary Syndrome. After the age of 75, your pulmonary reserve, the extra breathing capacity your lungs hold in reserve for moments of stress, decreases by approximately 35%. You have less margin than you think. Please equip yourself properly before you enter any space where rodents may have been, and always pre-ventilate. Open every door and window in the space and allow at least 30 minutes of fresh air circulation before you go in. This single step dramatically reduces the concentration of aerosolized particles in the air you are about to breathe. The third thing you must know is the correct way to clean a contaminated space. And this is the step I have seen more people get dangerously wrong than any other. So I need you to hear this clearly. If you find rodent droppings, nesting materials, or other evidence of infestation, do not sweep them up with a broom. Do not vacuum them. Do not use a leaf blower to clear the area. These actions launch the virus particles into the air and create an invisible cloud of infectious material that you then inhale directly into your lungs. It seems like the obvious thing to do. It is exactly the wrong thing to do. The correct protocol, as published by the Centers for Disease Control and Prevention, begins with wetting the area thoroughly. You prepare a disinfectant solution, either a commercial disinfectant or a mixture of 1.5 cups of household bleach in 1 gallon of water. You spray or pour that solution generously over the droppings and the surrounding area, and you allow it to soak for a minimum of 5 minutes. This step is essential. The solution deactivates the virus before you disturb the material. Then, wearing your N95 and your gloves, you use paper towels or disposable cloths to pick up the dampened material, and you place it immediately into a sealed plastic bag. That bag goes inside a second sealed bag, which is tied shut and placed in a covered outdoor trash container. All surfaces that rodents may have traveled across should be wiped down with the same bleach solution. Mop hard floors. Steam clean carpets where possible. Wash any fabric or soft items from the area in hot water. The wet cleaning method reduces your exposure risk by an estimated 90% compared to dry sweeping, according to guidelines from the New Mexico Department of Health. For your body after 60, this is not an optional refinement. This is the difference between a manageable risk and a catastrophic one. Right here, I want to pause for just a moment and ask something of you. If this video is giving you information you genuinely needed, please take 5 seconds to click the like button below and subscribe to this channel if you have not done so already. I produce content like this every single week, specifically for adults over 60, content that covers the health risks and prevention strategies that your doctor may not have time to walk through with you in a brief appointment. The YouTube algorithm only shows these videos to more people when viewers engage with them. So if you want this information to reach someone else who needs it, clicking like and subscribing is the most direct way to make that happen. Thank you. It genuinely matters. The fourth thing every adult over 60 must do is learn to recognize the symptoms of hantavirus infection with enough precision and enough urgency to act at the right moment. Because in this disease, the window between early symptoms and the point of no return is not measured in days, it is measured in hours. Here is the specific pattern that should send you directly to an emergency room without delay. Not urgent care, not a call to your doctor for an appointment next week, an emergency room the same day. If you develop a fever above 101 degrees Fahrenheit, together with muscle aches in the large muscles of your thighs and back, and those symptoms are accompanied by shortness of breath that is worsening over hours, even if it starts mildly, and you have had any potential exposure to rodents or rodent-contaminated spaces within the past 1 to 8 weeks, That combination is a medical emergency. And when you arrive at that emergency room, you need to say clearly and loudly to the person who first sees you, "I may have been exposed to hantavirus. I was near a space with rodents. Please test me for this." Do not assume the physician will make the connection. In a busy emergency room with dozens of patients presenting with respiratory symptoms, hantavirus is not the first diagnosis on anyone's list. You are the most important advocate for yourself in that moment. Your knowledge is your protection. Research published in the Annals of Internal Medicine found that patients who communicated a potential hantavirus exposure to their treating physician within the first 24 hours of respiratory symptoms had dramatically better outcomes than those whose exposure history was only identified later. Early recognition means earlier access to the intensive support that gives patients the best chance of survival, including in severe cases, access to extracorporeal membrane oxygenation, an artificial lung machine that can support breathing while the body fights the infection. I also need to tell you something specific about how aging changes your experience of early illness. Researchers at Stanford University School of Medicine have described a phenomenon they call inflammaging, which refers to the way the aging immune system becomes simultaneously less reactive in its early response and more erratic in its later response. What this means for you practically is that you may not feel as sick as you actually are in the early stages of a serious infection. The warning signals your body sends may be muted. You may minimize symptoms that deserve immediate attention. Please do not do that. If something feels wrong after a potential exposure, trust that feeling and act on it. And now, number 1. The single most important thing every adult over 60 must do, and the step that I promise you almost nobody is actually taking. Are you ready? Here it is. Have a direct, specific conversation with your primary care physician about your personal hantavirus risk before you go near any potentially contaminated space, before the summer rodent season peaks, and ideally this week. I know, you may have expected something more dramatic, another piece of equipment, another cleaning protocol. But let me tell you exactly why this conversation is number 1. Because the reasons are more powerful than most people expect. A 2022 survey conducted by the American Geriatric Society found that fewer than 8% of adults over 65 had ever discussed zoonotic disease risk, meaning diseases transmitted from animals to humans, with their primary care provider. Fewer than 8%. And yet, your physician can do something for you that no amount of bleach or protective equipment can do. They can assess your individual immune status. They can review your current medications to determine whether any of them, antihistamines, corticosteroids, certain blood pressure medications, immune modulating drugs, are suppressing your immune response in ways that make you more vulnerable than the average person your age. They can document your risk exposure on your medical chart so that if you ever arrive in an emergency room with respiratory symptoms, the attending physician has immediate access to that context. There is no vaccine for hantavirus. There is no antiviral drug you can take in advance to reduce your risk of infection if you are exposed. But your physician, properly informed, becomes your early warning system, your medical advocate, and your fastest pathway to the right care if you become ill. That is something nothing else on this list can provide. When you make that appointment, come prepared. Tell your doctor specifically where you live, what kind of property you have or visit, what kinds of spaces you have been in or plan to enter. Tell them you want this exposure history documented in your chart. Ask them directly whether any of your current medications could be affecting your immune response to viral infections. Ask them what you should do and where you should go if you develop the symptom combination I described earlier. Print out the key points from this video if it helps. Walk in prepared. A physician who is given specific, concrete information by a prepared patient is a far more effective advocate than one who is working from vague generalities. And for a 68-year-old woman who spends summers in a rural cabin, or a 74-year-old man who keeps a workshop in his barn, that single, informed conversation could be the most important medical appointment of the year. Let me come back to something for just a moment, because I want to close a loop I opened earlier. Throughout this video, I have been explaining the specific ways that the aging immune system creates vulnerability to this particular virus. The decline in mucociliary clearance that allows more virus to reach the deep lung. The reduced innate immune response that slows the body's initial counterattack. The phenomenon of inflammaging that can mask early symptoms. These are not reasons to feel hopeless. They are reasons to be informed and intentional. Because the adults who protect themselves most effectively from threats like this are not the ones who are fearless. They are the ones who understand the specific nature of the risk and respond to it with specific, practical action. You are not helpless in the face of this virus. You are intelligent, you are capable, and as of right now, you are informed in ways that most of your peers are not. You know what hantavirus is and what makes it dangerous. You know how it enters the body and why the aging respiratory tract is more vulnerable. You know the timeline of the illness, the silent incubation period, the flu-like onset, the terrifying speed at which the cardiopulmonary phase can progress. You know the real cases, real people living real lives who encountered this virus in the most ordinary places. And you know the 5 steps that separate people who are protected from people who are not. Do the rodent audit this week. Equip yourself with an N95 and gloves before you enter any enclosed space with evidence of rodents. Learn and use the wet cleaning protocol if you need to clear a contaminated area. Memorize the symptom combination that requires immediate emergency action and commit to acting on it without delay. And have that conversation with your doctor before the summer season opens those garages and cabins and sheds that have been closed since last fall. Independence after 60 matters deeply. The ability to open your own property in the spring, to putter in your workshop on a Saturday morning, to take care of your own spaces and your own home. These things are not trivial. They are the fabric of a full, active, dignified life in your 60s, 70s, and 80s. And protecting that life does not require you to stop doing any of those things. It requires you to do them with the knowledge and the preparation that this moment deserves. It does not matter how many spaces you have walked into without protection before today. It does not matter that you have never thought about rodent-borne illness until right now. What matters is what you do starting this week with the information you have right now. Your future is not fixed. It is shaped by the decisions you make today. If this video gave you something valuable, and I hope with all sincerity that it did, please subscribe to this channel by clicking the button below, hit the like button, and share this with one person today. One person. A spouse, a sibling, a neighbor, a friend with a summer cabin. You may not realize it, but that single share could be the most important thing you do today. And before you go, I want to hear from you in the comments. Have you ever cleaned a space that had signs of rodent activity without wearing any respiratory protection? And what is the one thing from today's video that genuinely surprised you? Leave your answer below. I read every comment, and your responses shape every video I make. Thank you for being here. Take care of yourself and the people you love, and I will see you in the next video.